uncharted paths. Joy News brings you a show for just that, dubbed COVID and the Law. I am live with the producer and host, Samson Ladi Anyene, this afternoon. Also, Joy News gets exclusive access to one of the key coronavirus treatment centers where patients are urging Ghanaians to never underestimate the disease as they also speak up against stigmatization. Join us on DSTV 421, GoTV 144 and on YouTube where we're streaming live. Join us with your opinions and thoughts on 0540109009. My name is Gifty Andopia. This is The Pulse. Please be my guest. So there you have it, the latest figures from the Ghana Health Service, 1,279. Those are the figures right now. We're dealing with 1,279 coronavirus confirmed cases across the country. And that's 125 difference from what we had recorded as of now yesterday. Let's take you through the regional breakdowns. Which region is recording what? Upper West has 8, Upper East has 8 as well. The Northeast region has 2, the Northern region has 13. Ten people have died, but the good thing is 134 of those who tested positive have recovered. Well, as you've seen the regional breakdown, I'm taking you to one of the regions. We go now on the phone lines to speak with our OT regional correspondent, Peter Seno. This region, we understand, has just recorded some 13 new cases. We're also learning that 6 Nigerians being quarantined at a guest house at Asato in the Kejebi district have absconded. Hello, Peter.
Hi, Gifty.
Peter, tell us about the source of that information about the new recorded cases in the OT region. 13, we understand, correct?
Yes, 13 this morning. The region woke up to the news of the 13 cases having been recorded in the region. And we must also say that this, from our sources, were part of those who were arrested or intercepted last week, I think a week ago. When they were running away from the lockdown in Accra to the countryside or the hinterland. And so these were or are alleged to be part of the number. Now, they were first intercepted at KJV where they were escorted to Nkwanta and then onward submission to the other authorities in other districts. And so we are learning they form part of that number that were traveling last week.
And let's talk about those who have absconded. We understand 6 Nigerians. Give us more on that.
Yes, they are Nigerians. They are from Niger.
Right.
Yes. They were part of in fact, they were the first people to be intercepted or arrested last week from one of our borders, Pillar 83, very close to Togo. And so they were brought in last week, Thursday, and so we got wind of that on Friday. And so subsequently, I think Saturday they were taken to their place where they were being kept. And so for being kept there, only for us to wake up Monday morning. In fact, we are getting the news today though, but they are said to have run away, absconded on Monday.
But we're talking about 6 of them now. Did you just say one of them absconded on Monday?
Sorry, 6 absconded.
6 absconded. Has the police in the...
6.
Go ahead.
Yeah, 6 of them have absconded, but they were being kept at a guest house facility in the KJB district, Asatu, a town, one of the towns in the KJB district. And so we were there to verify whether true or not. But they have left their belongings in the room, and then have left the place since Monday. Has
the police in the region said anything about this?
Yes, but we've been trying to speak to the district police command, since that falls directly under their jurisdiction, but they are unavailable. But our checks, our sources around them say there has not been any form of security provided for them. Wherever they have been sent to, there has not been any security provided them. But the DC has been speaking to us, and he says there has been some form of lax security provided them because the people were not aggressive, and so maybe that's how come they have absconded. And our sources also tell us that they were not being fed well, and that the meals do go to them, but sometimes very late, and the people have been complaining too. And so it's a mixed feeling and reaction as to what exactly would have necessitated their running away from the facility.
Peter, thank you. We'll get more from the DCE as well as the police in the region to find out whether or not they've been able to track these 6 people. But if you live in OT region, I'd love to hear from you. What do you know about this incident, and how are you keeping yourself protected over there? As 6 people were told, Nigerians were told, have left the premises of where they're supposed to be quarantined. I'll take you to the Bono East region. It is one of the 6 regions yet to record a confirmed coronavirus case. The Regional Health Directorate has since the outbreak taken 45 suspected COVID-19 samples to the Kumasi Center for Collaborative Research for testing, and 43 out of this figure tested negative. Bono East Regional Minister Mr. Kofi Amoako-Hene is currently on a monitoring tour of the various MMDAs on activities being done there so that no case is recorded in the region.
Well, when it's a software penny, and I'll be a malam penny, and I am now a yet to me. We have our one, or the Okoda, no opera, the soul support I about Okra and a pananoid. And yet, I'm a planning country. No smarting.
We're joined on the line by Anas Sabit. He's actually with the team on that tour. Anas, where are you at the moment, and what can you report?
We are in Chobodom, which is the capital for the Tichiman North District. We've been to the Kintampo municipality. That is where we started, and then we've been to the Kintampo South municipality. This is the 3rd district we are visiting. Today, what the minister is seeking to do is he wants to find out, monitor how these various assemblies are tackling the fight against the COVID-19 pandemic, and we've been briefed on the situation in the region. As stands, about 45 samples were sent to the Kumasi Center for Collaborative Research, and just this morning, before we embarked on the trip, we were told 38 of these samples have tested positive. But just this morning, as we were embarking on the trip...
Hang on, did you just say 38 have tested positive?
38 tested negative. So
yes,
if
very well. Very well, just so we don't misdirect. Mm.
And we...
And as I'm losing you, you may have to reposition. Nana Sabit is traveling with the Minister for the Bono region, and they are at the moment at Chobodom. And Anas is joining us with what he can report from where they are at the moment and what has been said so far. He tells us that 45 cases tested, 38 of them have proven negative. Anas?
Yeah,
Go ahead.
Good. So as we stepped off this morning, results of 38 of the 45 samples taken were in, and then out of this, the 38 have tested negative. But just this morning, understand 5 more results have arrived, raising the number to 43. 45 cases that have been, or samples that have been taken. All 42 have tested negative. So the region, the Bono East region, is only waiting for 2 more test results to make it up for the entire 45 that have been taken to the Kumasi Center for Collaborative Research. All the 43 have tested negative, And so as it stands, the region is yet to record a positive case of the COVID-19. And this is what the minister is seeking to ensure that all the municipalities, plus the district assemblies within the region, do not relax in the fight to ensure that the region will not record a single case throughout this period. So that is what is being done today. We are visiting three of these assemblies, and the tour will continue subsequently.
And what kind of message is the minister spreading across whilst he's meeting these people?
In fact, the key message is that apart from visiting the assemblies, we made sure we visited select markets within these areas we visited, plus some lorry terminals. And for the markets, most of these markets have been shut down. In Kintampo, where we know we have the Kintampo waterfall, which is a tourist site, the authorities have temporarily closed down the tourist site to revelers. And so as it stands now, all revelers are not permitted into the facility. Now, left with the markets have also been temporarily closed down, and the lorry terminals are working. So the minister had to visit this lot to ensure that the social distancing protocols that is being advised are being adhered to. Plus, there's an instruction on the number of passengers each vehicle has to take. So he has to also monitor from the lorry terminals whether they are abiding by this directive. I mean, taking lesser or fewer passengers per vehicle. So this is what the minister has been doing this morning, plus engaging the people on letting them know the need or the importance of ensuring that they remain safe throughout this period. So basically, that is he also tried to monitor in the public areas, within these areas we've visited, whether they have the hand washing kit comprising of the Verica buckets, the soap, the sanitizers, and the tissue papers. In fact, he's impressed with what we see so far with the three districts we have visited. So basically, this is what he's been doing as we move along.
Anas, finally, I'd like to find out, well, if you live in Bono East, you live anywhere near where the minister has been, I would love to hear from you. So send us a message on our WhatsApp platform, that's 0540-109-009. But Anas, before you go, what sort of feedback is the minister getting on this trip?
Hello, Gifty, come again, please.
Yes, what kind of feedback is the minister getting on this trip? What do the people tell him?
Yeah, I have been engaging with people, especially in Kintampo. I've had the opportunity to speak with some traditional rulers and the people on the streets who were impressed about the move by the minister. They believe the minister's presence in the region would kind of inspire the people to see that they are not being left to carry out this fight alone, that the leadership of the region are in support of what they are doing. So the people on the ground are excited with the minister's visit. They call on the authorities to come to their aid by providing more of the hand washing kits, especially in the public places. But generally, their perspective with the minister's visit has been impressive.
Hopefully, we keep it right there in the Bono East region and we don't record any cases. As difficult as that may sound, hopefully that actually happens. Anas, thank you for that update. Anas Sabitz there joining us from the Bono East region, where the minister is on a tour finding out what people are doing to ensure that the place doesn't record a case of coronavirus. We're told already that 45 samples have been taken. About 43 of them have tested negative. There is 2 more. We're monitoring that closely. We'll bring you the details. Like I said, I'd love to hear from you. Do not call my number. Just send me a WhatsApp to our WhatsApp platform and I'll share it with the rest of the world. What is your experience? What do you think authorities must do where you are to help the situation? What do you think is not being done that you believe will help? Let us know. We'll share it with the rest of the world and, of course, with the authorities. Now, former President John Dramani Mahama is calling on government to refrain from what he describes as political or parochial considerations in the fight against the novel coronavirus. This follows concerns over discrepancies in the data surrounding the COVID-19 tests conducted under the aggressive testing during the 3-week lockdown. In a televised address Thursday evening, Mr. Mahama expressed worry over inadequate PPEs and government's mitigation policies.
without emails, phone calls, Facebook, Twitter, Instagram, and WhatsApp messages from nurses and other medical staff from facilities across the country, reaching out to my office and pleading for protective gear, PPEs. Right from the start of this pandemic, public education and awareness has been poor. Government should speed up the initiative of manufacturing locally made masks, which can be washed and pressed or ironed and reused again. These should be handed out free of charge to the public. Strong public education on the safe use of masks must accompany this initiative. One gets the sense that perhaps because of the current low mortality in the cases we have confirmed so far, the president might be seeking to rely on what is called herd immunity as a strategy to fight COVID-19. But I dare say this is dangerous. We must remember that there are reports of reinfection occurring in some cases elsewhere. And also, prolonged immunity to the virus has not yet been proven at this stage.
Also, the former president is suggesting that the Social Security and National Insurance Trust, SNIT, should support contributors within this period.
My office has been flooded with correspondence from many working class people, especially in the private sector, who have not received their February and March salaries and are having a difficult time feeding and taking care of their families. The lockdown may have been lifted, but many businesses are still down and suffering. Employees are suffering too, just as the many players in the informal sector are also suffering. It makes me wonder why our Social Security and National Insurance Trust has not been responsive in this time of need of many of its contributors. Social Security contributions are essentially an insurance scheme made not just for pensions in old age before we die. They are also meant to help contributors in times of adversity such as this. Remember that not all will come out and queue for food. Not all will come out of their homes to receive the food boxes that we go around and hand over. But as has been done in other countries like St. Lucia, I think a token payment of all contributors of a certain token sum over 3 months would have afforded many the assurance of feeding their families during these abnormal times. While we wait for a clearing understanding of the factors underpinning the decision of the president to relax efforts to manage the spread of the virus, I urge all Ghanaians to continue to be responsible and not to assume that the country is out of the woods yet because of the removal of the lockdown.
Well, the Senate has indicated that that cannot be possible because it will be a breach of the Constitution, while some labor experts like Austin Garme, for example, has indicated that the law can also be amended to make this possible. Well, the entire world has taken a hit, especially to their economies as far as coronavirus sets in. Well, Mr. Mahama describes Ghana's economy as one that's on a ventilator.
Always necessary when you're building an economy to have enough buffers and create fiscal space so that when you are faced with a shock or adversity, you are easily able to overcome it. Unfortunately, this government has used a lot of propaganda. They said the economy has been the best that we've ever had since independence. Unfortunately, just 1 month of coronavirus and the economy is in ICU. If we didn't run to the IMF for the 1 billion rapid credit facility, it is possible that in the next 2 months, probably salaries could not have been paid. And so our economy is on ventilators, and it needs thinking to rescue it from the ICU. And that is why We are continuing to review what government is doing. We're looking at what the figures are. I have my team working. We had worked with what was available to us before COVID, but we have to review that because next year, as the finance minister said, he says it's going to take 3 years for the economy to come back on its feet. And I remember that a leading member of this government told us our economy was so robust and we had such reserves that for 3 months, if anything happened to us, we will be able to survive. We've not been able to survive even 1 month. And so we will be able to recover our economy, and we're looking at, what to put in place in order that we're able to recover. But there are things that the government can do in the first place. One of the main things you do when you're faced with adversity like this and shocks to the economy is to cut expenditure, frivolous expenditure. And that's why I said this is the time to look for the president to look at the number of his ministers and appointees. Definitely the public service is bloated, especially political appointees. And when you're asking people to sacrifice, you must show that you're sacrificing yourself. You can't have appointees running all over the place and drawing free fuel, and thousands of them, just all over the place, 125 ministers, and you're asking the people to sacrifice. We're all going to sacrifice. It's going to take sacrifice to rebuild this economy. And the president and the government must show the first example that they're ready to sacrifice.
Former President John Mahama there. I'm going to take a very quick break, but most of you have been sending in some messages, your thoughts, and what you think should be done where you are. I'll share some of that with the rest of the world. This message says, Gifty, I want to ask if anybody can be arrested for refusing to be tested after he has been asked to self-quarantine after the enhanced contact tracing. It has happened in my area and I'm being told there's no law, so the person in question is walking around freely in the community. It requires a lot of tact to get this done because the person can be infecting other people, and so force doesn't necessarily work, but I believe that the authorities are on it and they're getting it done. Ephraim, thank you for sending in that message as well. This one says, can someone recover from coronavirus without treatment? I don't think so, Mr. Adams. You send in that because you'll be showing the symptoms like coughing, being unable to breathe. You certainly have to be treated to be able to get out of that. The actual problem, this message says, is the problem of stigmatization is our own health workers, especially the ambulance workers who are under normal circumstances should just drive the car safely to take the suspected person to the nearest health center. They'll rather be blowing the horns as though it is the dead person they are carrying. When you do that, the environs at which the suspected person is would be left in a state of trauma. I get your message there. Hopefully we'll be able to solve that problem as well. Let me take my final message and we do a break. I think it's time for government to consider a total lockdown to slow down the spread. The authorities are not concerned about the confirmed cases because the death rate is not proportional to the recovery rate. Paul Bindili, send that from Chamba. Thank you for sending in your messages. Keep them coming. I'll take a quick break. I'll be right back. To stay with us. Welcome back to the show. Many thanks for staying with us. Ghana appears to be performing creditably well in the fight against coronavirus because of its testing capability. One of the centers conducting tests for the pandemic on the quiet is the Veterinary Service Directorate here in Accra. JoyNews' Latif Idrisu, who was given rare access to the testing center, where the head of veterinary laboratory, Dr. Theophilus Odum, explained how delicate the testing process is whilst demystifying the pooling process.
We are suited up and are ready to get in. We are good to go.
Yes.
So where are we going right now?
We are entering into the main biosafety level 2 laboratory.
Okay.
Where we do the sorting and pooling of the samples.
Let's get inside and give us detail about this whole pooling and what exactly you look out for when you conduct your test.
This laboratory has been
already been testing for other coronaviruses through some PREDICT project and others. But with this pandemic, we started testing from 28th of March, where we received the first RNA extract from Noguchi. So usually when we get a sample and the sample comes in here, we have our team, the team of doctors and technicians who work together to do the sorting. Sorting usually means that we compare the sample ID with the sample container to do matching. Each container comes with this document.
Okay.
So they have to make sure that every container is having a document attached to it. That is
So this document has the name of the
individual.
Okay. That we don't want to show because of
So
confidentiality.
that's the name of the individual and where the sample is coming with a specific sample ID.
Okay.
So this will accompany the sample sent by Noguchi to our facility here at VSD. And when it comes here, our team, like as you can see from there, are doing the sorting. So you can focus on them and see they are doing the sorting. So they sort the sample up to know that the number of samples tallies with the paperwork that comes with it. We have the samples coming in the container. They have already pulled the sample and we spray around it.
Okay, so this is the pooling that we've been hearing about?
This is the pooling sample. So these are 10 samples pulled together. So we'll do the extraction of this RNA. So this is a pool sample that we've been hearing about. So we have this sample, we have added everything in and pulled this sample together as one sample. Okay. So when we run this sample and it becomes positive, now we have to go back to identify the individual sample to know which individual is positive among this pool sample. That is all the pool we are talking about.
So this is what you have as a container?
Yes.
And then you put it in...
Yeah, so we put this one into an Eppendorf tube.
Okay.
You can see from there, they have collected a sample into an Eppendorf tube or cryovirus and give it a special ID. So as you can see, they are adding normal saline to the tubes and collect the sample in the pool into one small vial called Eppendorf tube or cryovirus. And that sample will be sent to the BSL-3 laboratory for the RNA to be extracted.
I will come back to you shortly. I want to find out from you, how laborious is what you do in this sorting process and pooling? How laborious would you say the task is?
It's kind of extensive because the samples come from all over, from different locations, and then you have to look at each sample, check the names, make sure they tally with the documents that we receive. So it's a bit laborious, yeah.
So that's Noni. Let me go to Chum. Chum, let me find out from you, how much of a pressure do you have at your back, considering the fact that we have some backlogs that we need to clear to know exactly our stand when it comes to the positivity rate?
Yeah, you realize that looking at the backlog that we have, once we receive the samples, then we are also trying so much that we put much effort to make sure that we are able to clear the backlog. We pull it as quick as we can, and then we send it for extraction so that the final amplification could be done, and then the results are out. So you realize that there are always samples coming. You always have to be on your toes to work.
Latif Idris' further report. We'll bring you more of what he's been doing in that space in our subsequent bulletins from next week. But President Akufo-Addo is urging West African heads of state to adopt a homegrown policy to address the coronavirus pandemic. The president today joined colleague West African heads of state for a virtual ECOWAS Extraordinary Summit on the coronavirus pandemic. Commending President Mahamudu Issoufou of Niger, who is the ECOWAS chairperson, for calling the summit, President Akufo-Addo told the Assembly that the Ghanaian response to the coronavirus pandemic is based on 4 principles, and that include the Ghana approach, which is mobilizing the social forces of the country, including religious, scientific, academic, political, and civil society, to deal with the threat of the pandemic.
The Ghanaian response has been based on 4 principles. Firstly, an all-Ghana approach, because we recognize that this is not a disease, a threat that can be dealt with only by government. We need to mobilize all the social forces in our country to be able to do so. We're calling upon religious, traditional, academic, scientific, political, and civil societies all to come together in an all-Ghana approach to deal with the threat. Secondly, that we are led and informed at all times by science and by the data that we are able to assemble. We're also learning from the experiences of governments that are further, of countries and governments that are further down the road in responding to the pandemic. And then finally, we think that it's also an opportunity for us to continue to push ahead with our Ghana Beyond Aid agenda. I think it is very, very important that we tailor a Ghanaian, a specifically Ghanaian African response to the handling of this pandemic, and not necessarily copy blindly the methods and that are being adopted in countries to the north of us and elsewhere. For instance, our scientists are very engaged in pushing forward the African manufacturing, vaccine manufacturing initiative. Indeed, there's a Ghanaian scientist is the chair of the board of those who are promoting it. We want to get to the possibility that we can produce a peculiarly African vaccine to deal with the problem, because the mutation of the virus in the various parts of the world is different. So we need to have our own way of responding to it. I share very strongly the views of President Ouattara when he says that we must continue to pursue vigorously our regional agenda. And I'm also very happy to hear that the Convergence Council is going to meet very soon to see where we are in terms of the developments that have taken place and the impact they have on our goals of monetary union and the rest.
President Akufo-Addo there and his counterparts from across the continent. Coronavirus pandemic's devastating chaos has also meant what was lawful when you went to bed may become unlawful in the morning. JoyNews brings you COVID and the Law, which seeks to give free platinum legal advice for your specific issues on Sundays at 2 p.m. Host of the show, Samson Ladi-Anyenini, joins me via Zoom. He's your legal light and help law in these trying times. He's actually joining me via phone. Hello, Samson.
Hi, Gilby.
Samson, do give us more of what COVID and the Law seeks to do.
Right, so COVID and the Law is JoyNews' response to give assistance that is direct and beneficial to individuals, to corporate institutions, among others, at a time when things are so difficult, you may not even be able to afford legal fees to reach out to a lawyer or a law firm to get the professional legal advice that is solid that you require. So myself and my colleague lawyers will be on the show. We will take direct issues and problems. As we speak, there are many people who are being laid off. Some have already been laid off. Some people are having their salaries cut to a point that what they will end up taking home will perhaps not be enough to take care of themselves and their family. As we know, in the United States of America, over 26 million people have filed for unemployment benefits. Unfortunately, in our part of the world, you can't go anywhere and file for unemployment benefits.
Exactly.
So we are seeking to guide people, both employers, employees, how to mutually, beneficially negotiate the difficult times when it comes to seeking to terminate someone's employment, seeking to get people to work from home, how many hours they'll be paid, how you have to go about all of that. And as we wake up almost every day, Parliament has passed Imposition of Restrictions Act, which empower the president to issue what is known as executive instruments. So far, he's issued about 4 or 5 of them. They changed their mind. People who went to church ended up being put in jail because they had to pay about 13,000, which is about the least of the fines to pay. They couldn't pay. They were put in jail for 3 years. There were some people who were celebrating their birthday. This is so basic. But because they organized a party to celebrate their birthday, they are having to pay fines or get themselves in jail. Over 400 people, in fact, are going to face a similar fate because they have been arrested.
Right.
They got out in the day, they were walking out to do their business. They were not going to steal anybody's anything, but they got arrested.
Yeah.
And this is the problem we are having.
So these are some of the very dicey issues that you'll be touching on starting Sunday. Give us a mental picture of how it will look like. Would you have people calling in and asking their questions, and then you have you and your team answer? How will it look like?
Right. So, like I said, direct benefit to individuals and those who make contact with us. Already, we have solicited, asked people to send us their problems.
Okay.
And some have sent us letters. They have sent us evidence of how they have been terminated from their work, how their salaries are being cut without any negotiating with their employers, and employers that have difficulties. We have received some of these. We will use them to give advice because we know there are many people who face similar problems.
Yeah.
But again, the phone lines will be open for people to call in and to ask us directly, tell us their problems, and we'll give them the solution directly. Unlike the situation where they would have normally have to walk into a lawyer's firm, and then they'll pay money before they are attended.
So that's like pro bono work being done here.
This is how multimedia and JoyNews is seeking to assist, free of charge, platinum legal advice, like you said.
Right, Samson, thank you so much. I'm looking forward to Sunday and to having you in the studio. I'm looking forward to hear some of the questions and see if they, if I can relate, and then I'll follow in the advice. Do you have any final words?
We'll help you. You don't need to be a lawyer to do it for you.
Samson, it's good to talk to you. Thank you so much for your time. We'll look forward to Sunday, and we'll see you here. Samson Ladi Anyenene is host of News File and also going to be the host of our new show, COVID and the Law, which is starting this Sunday at 2 p.m. up until 3 p.m. You want to certainly make it. This is free legal services for you here on JoyNews. I'm going to bring you the global situation on coronavirus now. Head of our health desk, Fred Smith, is joining me via Zoom. Hello, Fred.
Hello, Gifty. How are you doing?
I'm not bad at all. It's good to have you via Zoom. This is like the first time, and I'm feeling very excited. So let's take a look at the global front. I mean, U.S. President Donald Trump has been lambasted by the medical community, especially for suggesting that research into whether or not coronavirus might be treated by injecting heat could be transferred to the body. So essentially saying, well, how about disinfecting, injecting some disinfectant into the body? Tell us more about the global outlook.
Well, as you know, Gifty, the global situation has topped 2.7 million people have been infected so far. 192,000 persons have so far died, and we've had a lot of recoveries. Over 4.6 million people have recovered, but of course the United States is leading, so you'd understand why the U.S. president will come under such criticism if he makes such a comment. His country is indeed struggling with 870,000 cases in the United States alone, as many as 50,000 persons in the country have died. I'll take you around the world to see what's going on with coronavirus. In Singapore, for instance, they are saying that they knew that the foreign workers would be a stress point, and that's coming from a diplomat there, because persons who are not originally from Singapore and have found themselves there, that probably would be the situation in all other countries. If you happen to be in transit and you're caught up in this situation. We know some persons who are already in Ghana. They came for a conference and should have returned to their countries. They don't have any means of generating incomes in Ghana, and they are stuck here. They don't have relatives who can support them locally. And that's the challenge with many persons, and especially in Singapore, that situation has come up, and that country is trying to find ways of dealing with it. In the same country, the health ministry has confirmed 897 new cases, so their cases are going up. It's the reason why the diplomatic community is interested in those who are caught up in this whole thing. And it's so far unclear if the United States, Europe can reopen. Their new coronavirus cases are high because Fitch is saying that once they do, cases can go up again. So there's that risk again for the United States and Europe. But already, Spain has already started reopening some of its, easing some of its lockdown measures. And Germany is also recording more cases. It gives you the idea of what's happening around the world. Cases are easing a bit, but there's a risk if these countries decide to open up.
Fred, I tell you what, it's been very interesting how gradually the focus has shifted from the epicenter or the origin of this virus, which is China, Wuhan to be specific, and now to Europe. Europe is actually easing the restrictions. We've been speaking to Thomas Sparrow, who's been telling us how they are gradually trying to get back to normal life. But do we know what is happening in China, where this outbreak first started?
Well, China in the last 2 or so weeks have also started easing their restrictions. In fact, they were the first to start easing restrictions. And Wuhan specifically, where the whole epidemic or the pandemic broke out, they have resumed full service. So a lot of companies working then, some of the popular air conditioners, some vehicles are all produced in Wuhan. They've all resumed work fully. And so they have resumed, and other parts of China are also fully at work. So the Chinese economy is back full time, and it's only a matter of time because the cases have also significantly dropped.
Well, we see how that goes. But Fred, what can you say about the African outlook? We just played a clip of President Akufo-Addo interacting with his colleagues, heads of state across the continent. What do we know about the African outlook? How is it looking for us as a continent?
Well, let me start you from West Africa, the ECOWAS region. We so far have 6,525 cases in all, and we've had 1,968 persons recovering. The deaths in West Africa stands at 170, and the active cases 4,387. That's the subtraction of our recoveries from what cases we have. And so that's our situation. In terms of which countries are doing what in terms of the cases, you have Benin with 54, Burkina Faso 616, Cape Verde with 82, Cote d'Ivoire with 1,004, the Gambia with 10, Ghana 1,154. Well, Ghana's case has not been updated yet because we've gone up from the 1,154. Then Guinea 862, Guinea-Bissau 50, Liberia 101, Mali 309, Niger 671, Nigeria 981, Senegal 479, Sierra Leone has 64, and then Togo with 88. That's the situation with West Africa. But of course, for the Africa region, some of these countries, South Africa, for instance, is one of the countries recording most cases in Africa. I'll look for their figures and give you in a jiffy. But we have South Africa, we have Egypt. South Africa with 3,953 cases so far. Very soon they will hit 4,000 cases, and altogether they have 75 deaths in South Africa. And then for Egypt, they have 3,891. Morocco follows with 3,692. Those are the countries leading in Africa in terms of cases recorded for coronavirus. Gifty.
What can we do but to keep ourselves protected and make sure that we keep others protected as well as we look at these rising, ever-rising figures? Fred, thank you so much for those updates. And I was just wondering what the situation now report is from your home as well.
It's very calm at home.
It's very calm. I can see that.
Yeah, it's very calm at home. Everybody is safe because mommy and the children don't go out at all. I'm the only one who sometimes go to work and return.
Who is on the front line?
I also take extra precaution not to bring any virus back home. So everything is fine.
Hopefully the precautions are working. Fred, thank you. Fred Smith is head of our health desk here, working from home, obviously, coming to us via Zoom. Fred is also the producer for the show, I must say. So he's working from home, and we have other producers who are working from here as well. But that's on a more serious note, the global outlook. It's not looking so good, especially for the United States, for Europe, but they're still trying to ease up gradually. It's not very good for the African countries that Fred indicated, also South Africa, Morocco, etc. Well, what you can do in your part to make sure that Ghana doesn't even get there is to stay at home if you have nothing doing, no business doing. If the things you need to do outside can be done at home, stay at home and get it done. What you can also do is wear your face masks, especially when you're among people. What you can do is keep washing your hand and keep using sanitizers. You can also be spraying sanitizers or rubbing alcohol on your shoes, because we understand that you can carry the virus right into your homes with your shoes. It doesn't get any easier, but you have a personal responsibility. All right, let's move away from COVID-19 with some of your text message before we do some politics right now. Okay, well, it's still the politics is still COVID anyway. It's like we can't do anything without COVID right now. So some of the messages coming in: Trump's up to the oh yes, I think you're trying to say thumbs up to the local manufacturers doing PPEs, but in order to be sure of its quality and trustworthy material, I'll encourage the COVID-19 team to consider testing the workers so that our able and hard-working frontline workers are not infected with the virus. From Wisan Obed at Zabzgu in the northern region. Mr. Obed, he's been sending messages quite consistently. This one has a very long message. I'll see if I can read some of it. Please, I don't want to mention my name. If JoyNews can take it upon themselves to come to OEB, Valley View University Hospital and the CHAG to investigate. Most of them are listed as frontline workers, nurses, but are not. They are rather those at the administration managing the hospital who don't come in contact with patients, leaving most of the nurses and the midwives behind. You go on to say that the annoying part is that the HR's name was listed, leaving most of the frontliners. We'll have to investigate this. We cannot independently confirm this. Without investigation, we can't go on with it. Let me see if I can get one final one, and then we'll move on. Good afternoon, Gifty, he says. In fact, since Wale Wale recorded its first positive case, they took samples of about 42 individuals, and out of the number, we are told that only one person is positive. So the question is, how come only one positive case and authorities are not saying anything again? From Wafik in Wale Wale. Wafik, are you wondering why only one positive case came out of 42? It's possible, but yeah, certainly it's good to ask the question. I'm going to do politics with COVID-19 at this time. This year's election will be the third and final contest between John Mahama and Nana Addo Dankwa Akufo-Addo, who becomes Ghana's president. Having lost to John Mahama in the 2012 elections, Akufo-Addo won convincingly in 2016. And as election 2020 approaches, the stakes are even still higher. However, whoever emerges victorious, I should say, serves the final of the constitutionally permissible 2 terms. But the spread of the coronavirus into the country presents a challenge for both these candidates. In the following report, my colleague Winston Amwa puts the spotlight on the impact of the COVID-19 pandemic on politics in Ghana.
In February 2020, the NDC launched the Speak Out Tour. The tour, which was to take place in all 16 regions of the country, was to enable its leader and flag bearer, John Mahama, to meet, interact with, and listen directly to the people of Ghana. The party's manifesto team was to accompany Mr. Mahama to take advantage of the tour to listen to the views of the grassroots and incorporate them in the party's manifesto. Having toured the Western North, Ahafo, and Upper East regions, Ghana recorded cases of coronavirus, causing the president to ban public gatherings.
All public gatherings, including conferences, workshops, funerals, festivals, political rallies, sporting events, and religious events such as services in churches and mosques, have been suspended for the next 4 weeks.
Political campaigns took a hit. This caused the flag bearer of the NDC, John Mahama, to suspend the Speak Out tour. Even though the partial lockdown has been lifted, the ban on public gatherings is still in force. So how has this impacted political activities in this election year? I caught up with political scientist and lecturer at the Political Science Department of the University of Ghana, Dr. Isaac Owusu-Mensah, who in 2016 correctly predicted victory for the NPP.
The season of the campaign will be shortened as compared to the previous times, because as we speak now, if it had not been the COVID-19, NPP will be seriously campaigning now for the 149 constituencies that they were going to have the primaries on. That would have been 25th of April, some few days from now. That's the coming Saturday or so, I guess. And then NDC probably will have also come out with their running mates by now. But now all this is suspended, and therefore the time of the campaigning will also reduce. Political parties, the time to campaign will be short, and for them, the shorter the campaign season, the better, because the amount of resources that they will have disbursed during the longer campaign season will be reduced, and therefore everybody will have to be on board.
For the General Secretary of the NDC, Johnson Asiedu Nketia, apart from the NDC's inability to organize parliamentary primaries in some 20 constituencies, the party has fallen.
Indeed, we're going to do the next batch of primaries the Saturday after the president's first directives. So we had prepared everything, but we immediately held a meeting and announced that health first. So we have suspended all our political activities.
However, for General Secretary of the NPP, John Boadu, the effect is enormous.
For us in politics, it's because we do mass mobilization, because we do mass gathering, mass meetings. Its impact is enormous. As you are aware, we're expected to have parliamentary primaries for where we have sitting members of parliament to the 5th of April. Because we still have in place social distance measures or restrictions with regards to mass gathering, public gathering, rallies and all that. We have to postpone it indefinitely. We're also expecting by May 2nd to have launched our campaign.
So how will the ban on public gatherings affect the political fortunes of the NPP and the NDC?
As for the elections and so on, we are not concerned about elections or discussing elections, discussing registration, discussing this, discussing that. Because the same people, if we are saying that the health crisis is an emergency, and if we are not careful, we don't act properly, it can consume us. We cannot be seen to be discussing what will happen after the health crisis, because if we don't act well now, we can be consumed such that there will not be any tomorrow for us to be talking about.
But John Boadu is very optimistic his party will win the 2020 elections.
For us in the Digital Patriotic Party, we believe that if elections is held today, we will win, because we've done so much.
The economic conditions of electorates play a major role in the electoral choices, and how the governing party responds to these play an even bigger role. During the lockdown period, government rolled out various packages to support small businesses, the poor and the vulnerable. Dr. Owusu-Mensah believes the NPP has taken advantage of this reality. He explains further.
And I think so far, apart from the lifting of the ban that people have been against, that they are not very happy with, all kinds of misfeeling, all the steps that the government have taken so far, people have appreciated it, except this one. But as the expert always keeps saying, we don't know and don't have all the information. So if the government also get the lifting right, that is really going to be their advantage. What I was a bit surprised was that I think NDC should have also come on board, strongly on board, not necessarily doing their own thing, because all the resources that the government, the MPP or the government is putting on the ground, it's not from the MPP, it's from the government. So NDC should have joined them in the distribution of the food. We are also here to help the distribution of it, so that will reduce the strength that and the advantage that the incumbent government will have. But unfortunately, it didn't happen that way. So incumbent government have really have a lot of advantage to its side in terms of distribution of their resources. And normally when it goes to elections, people reward political parties for what they have done and what they have not done.
Another factor that is central to the upcoming election is the voters' register. The Electoral Commission has been emphatic that there cannot be a credible election without a new voter register. Director of Electoral Service at the EC is Dr. Sribo Kwaku.
As far as the Commission is concerned, we are saying that we can only ensure credible register with a new register.
Okay, but that brings back my question, and this is relevant, if you may. In the midst of the uncertainties brought on by COVID-19, nobody knows when this is going to pass. Is the EC at least now reconsidering that and saying, in a push come to shove, we will have to shelve this and just do limited? Is that something you are considering?
Then can I also ask a question?
Please do.
Yeah, in the phase of the COVID-19, are you also thinking of not having election 2020?
I don't know. I mean, it's something that the Electoral Commission has to do.
Anybody in the Electoral Commission, knowing the resources that we have, knowing the situation of the register,
and I certainly have company when I cover my mouth and my nose like this, just like you should if you have company wherever you are. Winston Amwa, producer of that short documentary, joins me here in the studio. Tell you what, it's a very long one. We've just given you a part of it. Winston will tell us, give us an idea what's supposed to be in the rest that you haven't seen. But it certainly will be on our YouTube link. We'll urge you to go to look at it. Winston, you're welcome.
Thank you very much, Gifty.
So let's start with what we haven't seen yet that's also contained in this mini documentary. We see the implications, you know, the story, the background, and we see the implications, the possible implications for election 2020, given coronavirus and all. What else is in the reports that we haven't seen?
Well, so that's the whole bit about elections and whether or not we need a new voters register. You know, haven't talked about the effect or the possible effect on the electoral fortunes. We then get into whether or not the Electoral Commission would still need to compile a new voters register for the upcoming election. For Johnson Asiedu Nketia, he still believes that, look, we're talking about after the pandemic, but what if we're consumed by the pandemic? So for him, he would prefer that we stop talking about, you know, issues to do with, you know, life after COVID-19. He wants all of us to actually, you know, still focus on dealing with COVID-19. And once we deal with COVID-19, we'll be able to know what to do next.
That's Asiedu Nketia.
Yes, that's Asiedu Nketia. But for John Boyd, he says that there's no way we can go into election 2020 without a new voters register.
So the focus, it appears that the focus of the NPP is to, hey, just push right ahead and get the voters register done, whereas the NDC believes that let's take a look at the coronavirus, deal with it, and then move on with our lives from there.
So yes, when I spoke to the two general secretaries, Johnson Asiedu Nketia believes that this is not the time to be talking about election this and election that.
Okay.
When it comes to John Boyd, he answers the question and says, well, about 1.2 million Ghanaians would turn 18 this year, and you expect those people to be given a chance to vote. How do they vote? They can only do so if they are registered. And so for him, there has to be a sort of a new register. Now that could be in compiling a totally new one or going for a limited registration exercise.
I see. Some of them have even been talking about an indefinite postponement of political activity. So obviously, the NPP cannot go on with its primaries. The NDC, former President John Mahama, has indicated that they have put certain things on hold. Did they at any point in the documentary talk about the alternatives in place? I mean, assuming election 2020 has to be done in a time of coronavirus, are they thinking of any alternatives in terms of even their own campaigning, how they reach out to people, etc.?
Exactly, and that's a very important question because, again, for Asiedu Nketia, deal with COVID-19. Deal with it. We don't know, for him, he says, we don't know what would happen. Okay. We are not sure whether we'll be alive after COVID-19. Those are his statements. We don't know whether we'll be alive. So let us deal with it. When we are done dealing with it, we can then begin to think about life after it. But let us not, like our people will say, you don't stand in hands and say that you're actually getting them off your skin. Okay. They still will be there. So for him, it's the same case. But for John Good, he says that the NPP would not want to stay in office one more day past their time without an election asking them to do so. And so elections will be done.
It looks like interesting times ahead. But what sort of feedback has come on the back of this report?
Well, there's been, great feedback there. I mean, and even as John Mahama spoke yesterday, he makes reference to, the fact that for one of the leading members of the NPP, and you had John Boydu. Okay, I mean, I've talked about John Boydu's comment that there can't be an election without a new voters register. Certainly capturing his attention. Lots of people have been reacting to it. They've talked about how, they think that the issue of the new voters register should be put aside for now. But I'm also being told right now that even, within a lot of NDC WhatsApp group discussions and other things, the general consensus is that there's the likelihood that there would be a compilation of a new voters register, but that would be a limited one. And so the time to start preparations certainly should be now.
Finally, Winston, before you go, you talk to political scientists in this documentary and you get their perspective. I'm interested to find out from your own perspective what the scientist perspective to politics has been on our voting patterns or on our voting trends, if there is any that's shared in this documentary.
Well, so for the political scientists I spoke to, and this is Dr. Isaac Owusu-Mensah, who correctly predicted victory for the NPP in 2016. He's talked about how people would always look at the things that are being done. They would reward those who have been there for them, and they wouldn't, reward those who haven't been there for them. Another thing is that when it comes to politics, and so he says that based on how the NPP is gone with the handling of COVID-19, it looks like they have the advantage. And so he would have expected the NDC to have joined the NPP in, say, the sharing of food, because, I mean, it's not NPP's money, it's Ghana's money. So if it's Government of Ghana funding or funds, it means all can join to make it work. And the thing about elections also is the fact that you always would look for alternatives. You say politics is the posing of choices for people to choose. And so you always would look for choices, and if people are very comfortable with what they currently have, they'll stick with it. If they are not, they certainly would vote that government out. So for him, he thinks that if the lifting of the lockdown doesn't go well according to plan, it could affect the NPP. But if it does, bingo for them.
Winston, thank you very much. I'll end that conversation with this message that just came in. It says, to be frank, under this unfortunate situation, if anyone is prioritizing politics above this tsunami, then God save us as voters. Is there no alternative to the compilation of this new voters register? Malik is sending us that message from Kumasi. Malik, thank you for sending in. And Winston, thanks so much for coming. You're welcome. Thanks for that documentary. Winston Amuada, my colleague here, has been hosting Upfront and also a part of our Super Morning Show team. Welcome to Frontline. We continue to celebrate our frontline workers. We've been focusing a lot on health and those in the security services, the efforts they put into saving lives during pandemics. Yesterday, government announced a special package for health workers at the forefront of COVID-19 fight in the country. On Frontline today, we speak with Dr. Ernest York. He's a Greater Accra Region Chairman for the Ghana Medical Association. Dr. York, thank you so much for joining us today. He's joining us via Zoom. Dr. York is the Greater Accra chairman of the Ghana Medical Association. If you've monitored the conversation, they've had their own concerns with the lockdown. They've had their own issues with PPE, so we're talking to them. But the focus really is to celebrate the efforts that they put in. Ghana has not been to the, we're not at the level where other countries are. We certainly hope not to get there. But in the meantime, we're celebrating our frontline workers and we're letting them know that we're here with them. We're in this together. Let's see if there are some more messages. This one says, please, my biggest story is the frontline workers. I'm grateful to them and all stakeholders, as well as all who have loved to stay at home and ensuring social distancing. Please, who buries those who died through the COVID-19? Is it the government or their families? Morris from Akosombo is asking that. Morris, I don't have the answer. I'll try and find out if the GMA can give us that answer here on Frontline. But thank you so much for showing appreciation to our frontline workers. This message said, it's an event I witnessed in the night. My wife was in labor at the Holy Family Hospital. A woman equally in labor was rushed to the same ward by a stranger. When the doctor asked for the husband, he was somewhere else chilling with another woman, whilst his own wife was struggling for life. Indeed, relatives came later. Well, I'm not quite sure what the story is. If you're celebrating a frontline worker who came in handy at that time, thank you very much for sending your message in as well. Okay, only Allah has a reward for our health workers. That's Nazib texting us from Yendi, all the way from Yendi. Nazib, thanks for texting us. How is Yendi and how is coronavirus going out there with all the curfew that you've had to endure in the past? Certainly good that we're back in normal times there. How is Yendi at the moment? This message says, Gifty, I want to know, do private hospital staff and private ambulance drivers fall under frontline workers, and do they qualify for the insurance package? Well, the last time we spoke to the Association of Private Health Workers, we were told that they've been asked to send in a list to government. We'll be following up with them to find out whether that list has been submitted to government and what became of it. But we do know that the health minister also at that press conference said they weren't really sure because they were still working things out to find out who actually qualifies to be a frontline worker. There has been a directive from the Office of the Director General of the Ghana Health Service that all pregnant women and nursing mothers should be excused from duty, but some hospitals are not adhering to it, with the excuse that the hospital management has not been served any official letter. Please, what has been done about this? It's a question I would like to put to the Ghana Medical Association. What do they know about this and what are they doing about it? Hopefully I won't forget when we raise Dr. York back on the line. Let's take a very quick break. We'll be back with Frontline. Welcome back. Many thanks for staying with us and sincere apologies for that. I do have Dr. York on Zoom with me. Dr. York, it's good to have you. Good afternoon.
Surely, a little technology challenge, but that's okay.
I know, right? It's good to have you. You look like you're all dressed up for work. Are you working?
Yes, I'm running a late afternoon shift. So immediately after I'm done with you, I'm off to work. How's it going? Well, it's been stressful, you know, like everybody else, you know, you are not sure what is in stock for you once you step out to work. And especially for us who are frontline, that's even more, you know, traumatizing sometimes. You know, I'm preparing to leave home and I'm asking myself, what am I going to meet? Who am I going to meet? Is it a possibility that I may come in contact with a patient or even a co-worker who may have the condition? And So, it has impact on us psychologically, but we are praised up for it.
And that actually adds to the physical, scare of it all, because this is working in your brains, this is working in your mind, the uncertainty alone, plus the fact that you get home, you get to work, and now you get to be confronted with the reality on the ground. I mean, how are your colleagues taking this?
Well, we are putting up brave faces, I must confess. But when you speak to people one-on-one, you sense a certain level of fear in what they say, because we've seen co-workers being infected, both doctors, nurses, and other health professionals. And we've seen some succumb, unfortunately, to this COVID-19. So it is real, and that's, put some psychological stress on us. However, we, are committed to delivering what we are expected to do. Besides that, I'm sure you heard about this constant, complaint about inadequate PPEs, and that is a present and continuing concern that we have. And that also adds to our level of uncertainty and psychological stress.
I'll talk about the PPEs on its own, but before that, I just want to find out, do you receive, or is there a sort of arrangement to give people like yourself some psychological support or some emotional support whilst we're in these times?
Well, I've been lucky in the institution where I work. Management has organized a training session for us, the frontline workers, and they've taken through us what to expect and how to deal with psychological stress. And they've also, put up a team that is on standby for us to access when we think that we need some form of support. But that is where I work. I work in Kolebu, and it is not the case. As a chairman, I've spoken to a lot of the reps from a lot of the hospitals in the region, and that's not the case. And at this stage, I'll implore all health facility managers that they should take it seriously and try and organize similar, things for their workers, because it's not easy. It's not just being there to work, but the doctor, the health professional must be in the right frame of mind to be able to deliver what they expected to deliver.
Let's talk about PPEs. It's been one of the biggest issues since we started this conversation. I mean, when our numbers were fewer, it wasn't a big part of the conversation. Now we can't run away from it, and people are actually predicting, like, we don't know what's going to happen next. Even at this stage, we're complaining about PPEs. What really is the problem? How has it been resolved with the GMA stepping in and all of that?
Well, I don't even think that it wasn't a problem from the beginning. It has always been. We didn't prepare, quite enough to be able to, manage these, what we find ourselves better. I'm sure we thought, it is a disease from China, it is a disease of the white person, it's a disease of somebody from a foreign land. But little did you know it is clearly something that can come to us. So it has come, and PPEs continue to be a challenge. I know that the government has taken initiatives, to supply, to procure, and recently they've even engaged some local manufacturers to produce some face masks. But I must say that effort, unfortunately, albeit late, is also not enough. We continue to hear on a daily basis from various facilities, inadequate PPEs, and that makes people uncertain, and sometimes patients may suffer because the health worker may not be prepared to risk his or her life to attend to a patient if they are not adequately protected. And I know that many doctors, I can speak for on authority, that they supplement what their institution gives them to be able to adequately gown and be protected, to be able to attend to patients, when they have to don these PPEs. So it's a challenge.
One doctor I spoke to about PPE said, I am buying it myself. I'm buying face masks myself. But for how long can I keep using my salary to buy PPEs? We certainly can't live like this for long. What, in your perspective, and I believe in the GMA's perspective, can be done about this problem with PPEs, especially since it's not going away?
It is not. And the other scary bit is the increasing numbers. And that will mean that the demand will continue to rise. And so the first point for me, honestly, will be to identify other local industries and interests that will be able to supplement their production. The other thing too we can do is to approach foreign sources. I know that it's in short supply elsewhere, but this thing we shouldn't give up. We should still try. And at this stage, we also call on individuals and well-meaning Ghanaians, private institutions, to come in and help. I know that people are trying, but I would say Oliver Twist asked for more. It is not a comforting situation we find ourselves, and that has been on the lips of everybody. And it scares me that if we are not careful and we get to a certain stage, both the health practitioner and the patient may be in danger, and it may not be good for us. So I think that heads must come together. GMA has started, but we've been engaging government on finding solutions. But I think that they are trying, but they should try harder, and the individuals should also step in and to help. Otherwise, all of us, may suffer for this shortage of PPEs that we find in the system now.
Well, if you're hearing here on the front line, you certainly want to put in a hand of help. I'm sure you can reach out to the GMA, you can reach out to hospitals, you can reach out to authorities, anyhow you want to help. I know that companies are helping, and we'll be celebrating some of those companies as well as we go along. But please, as you've heard the plea, do step up. Doc, I want us to talk about frontline workers. There's been a big debate about who qualifies to be a frontline worker, especially when President Akufo-Addo announced the packages for them. As I speak with you now, I'm receiving a lot of messages right here on this show. People are asking, are we clear about who falls within the category in these times as a frontline worker?
Quickly, let me add, before I just answer your question about the PPEs. GMA on its own, we've put up a fund that, we are soliciting from well-meaning Ghanaians. And so far, we've distributed, PPEs to many treatment centers and institutions in Ghana. And I also know that the Women's Wing, the Medical Women's Association, is also leading another, crusade, to provide nose masks locally produced, and that's also been ongoing. And so this is some of the things that on our own as GMA we are doing. But quickly back to your definition of who a frontline worker is. You know that it's always been difficult. If you ask government sources, the definition keeps changing. And remember the last fiat that the president issued, it says, those who work directly with, COVID patients. The next day, you ask the Minister of Health or the Director General, it changes. And GMA is continually engaging them. And what has also happened that because of this varying of the definitions of who a frontline worker is, the government has been issuing, about 3 or 4, instructions to the controller, asking them to implement, what they are thinking who a frontline worker is. And certainly on my mind, every health worker that comes in contact or has the potential to come in contact with a COVID patient is a frontline worker. Because the person sitting in the emergency room, the person sitting on the ward, the person at the clinic, the person in the laboratory, the person who is taking patient's file, somebody may walk up to the person and say hello and call for, so everybody is at risk. So I think government should be able to define on the broader sense so that it limits this agitation on the ground, and therefore everybody's mind will be clear and they will rather concentrate on what they are trained and required to do as frontline workers.
Doc, in the coming days, I think we'll get a chance to talk more about this. But before we let you go today, I'd like to find out how this is impacting your relationship at home, with your spouse, with your children. How has COVID-19 changed life for you?
You see the broad smile on my face.
I do. I have one as well.
It's enormous. Look, we are, apart from the personal, psychological stress and the physical stress from working long hours, wearing those difficult PPEs, which you feel like you're an oven, we're having to stay out longer. So, you miss your spouse and your family, your loved ones at home waiting for you. You come and there's a Verenka bucket at the door. You must wash your hands before you enter the house. as if you're a stranger. You must go straight to the shower with antiseptic soap. Your clothes must go into the laundry. You are having to spend more whilst you are earning less. You and I go to the market and you know that everything else has increased. All consumables have increased. So it has toll both on us as individuals and as a family. And what we are hoping for is that this pandemic passes over us quickly. But as soldiers, let me just add, as GMA, we are committed, in these difficult times to stand up and be counted. If it was a war time, we'll count on the soldiers, but this is a pandemic time, and it's a time for health workers to prove our merit, and we are committed to it. So what we only ask is the support from, the government to provide us what we need, especially PPEs, and that the general public as well support us with the equipment and the accoutrement that we need. And also let's, in our own ways, keep safe by practicing what we told, hand washing, using hand sanitizers, staying home when you don't have to, and ensuring that you observe the required social distance. I'm sure when we do these things, we can't bring the pandemic under control, and Ghana will be better for it.
Is that your wife's portrait right behind you?
It is, so I'm getting inspirations from it before I step out.
Oh, wow. If you could just shift your head a little bit, we'll have a clearer picture if you want us to see, of course. Oh, there. She's a pretty woman. Our regards to her, and thanks to her. Thanks to her for giving you that inspiration and also being there for you in these times where you need a lot of psychological support and emotional support. I believe your kids support you as well.
Surely they do. They have concerns of their own, but I assure them that I must do it for country. So they are all in support, and thank you too for the opportunity.
Dr. York, the next time I come to you, I'm really looking forward to hearing some very interesting stories, if they are, of the experiences, the individual experiences, the unique individual experiences you've had in these times of COVID-19. I hope we'll get the chance to do that one of these days.
Surely.
Thank you so much. So this is Frontline, and what we do is celebrate our frontline workers. Dr. York is one of the persons we're celebrating today. You've heard him talk about the psychological stress that most of his colleagues have had to deal with himself, but there is some sort of support, but not every hospital will have that support. So you can appreciate the stress they're going through. PPEs, of course, continue to be one of the biggest problems. If you can, do step out and support these organizations. Dr. Ernest York is the chairman, the GMA chairman for Greater Accra region. Thank you so much once again for bringing us into your space and coming to people's homes today. Now, tell you what, 2 persons being treated for coronavirus infection at the University of Ghana Medical Center have been sharing stories of trauma and anxiety as they dread being stigmatized after recovery. There have been several reports from parts of the country with some people still doubting the existence of the virus in Ghana. JoyNews obtained exclusive access to the UGMC treatment center for persons infected with the virus. They're warning people to be cautious and stay at home as government continues to battle the disease out.
Is the University of Ghana Medical Center, one of the health facilities which is catering for individuals who have contracted the coronavirus. Today we are going to have an exclusive access to the patient tower here in the facility, which is holding, we understand, 8 individuals who have been infected by the virus. I'm joined by Dr. Emmanuel Amoa. He is one of 2 specialists here at the facility who will be taking us on a tour. What should we expect? I mean, I'm not scared. I want to see this.
Yeah, so I think there's nothing to be scared of. We need to just prepare as we see the patient. So we are going to take you through the pathway to access care when you test positive. I'm here with my colleague, Dr. Ama Edwin.
Dr. Ama Edwin, I don't know how to describe you, but you're an interesting personality. I mean, the brief interaction I've had with you, you appear very, bubbly and everything. I expect that this tour that we're going on won't leave me traumatized at all.
No, it will not. It will not. I think you, at the end of it, you'll be able to say, oh, say you cry. You will not be traumatized. And if you experience any trauma, you are in good hands. So.
Great. So, Dr. Amma Edwin there, Dr. Emmanuel Amwa, they're going to take us on this tour. Come with us and let's just demystify, a lot of the things that are being bandied about COVID-19 and the people who have contracted the virus. Let's go.
So we are following a route to where the frontline health workers are.
Okay.
That is where we get prepared before we go see patients.
I like the fact that you said patients who have COVID-19 and not COVID-19 patients, because that's the language we want. When you say COVID-19 patients, it's stigmatizing, but when you say patients with COVID-19 or person with COVID-19, so thumbs up.
Soaked with chlorine. So you step on it to disinfect your boots.
Actually, we are in Crocs, so this is to disinfect that.
Yes. So this is what we do.
We'll have to do the same?
You have to do the same with your shoes. This is to, this is chlorine solution. So when it comes into contact with any contamination, let's say the virus, then the virus is destroyed or killed, if I put it that way, so that we are clean before we go in. As you can see, this is a very changing room.
Okay.
Frontline workers will change. Yeah, they will wear their scrubs, as I'm wearing, before they start work. All right.
So we are essentially in the building.
Essentially in the building for frontline health workers.
Okay. The PPE room. I'm sure many of you will be interested. The PPE room.
This is where we don't. We wear the appropriate. We wear the appropriate scrubs or personal protective equipment before we go and see a patient.
Okay, so, that will include the mask, the scrubs, the gowns, the coverall.
The coverall, what to wear over your head, the head covering, the goggles. There's one of the goggles. Typically, the face shield is outside, but all the other PPEs are here. So based on the patient that you are going to see and the work that you are going to do, then you wear the appropriate PPEs. All right. So,
okay, yeah, so the donning area.
So when you enter, you wash your hands as well. We are going to wear our full PPE. The reason is simple. When you go in there, and then anybody needs any care, because we are in full PPE, we can offer the level of care, the needed care for every patient. If you are not fully donned, then when you go in, there may be some procedures you may not be able to do because you are not in the appropriate personal protective equipment.
I'm looking forward to see how the donning is done in, the appropriate ways of, donning the PPEs,
So there are protocols. And the protocols have steps, so the steps will be followed. So we have supervisors here whose sole responsibility is to make sure that